I'm excited to talk to you all about a very common issue, and that's why I labeled it as the ABCs here in West Michigan, and that includes allergies, breathing, and the care of our sinuses. And so, without further ado, I'll talk about the following things and hopefully answer some of these questions for you. You're in the right place if you've ever asked any of these questions. Do I have allergies? Why does my nose run? And what causes nose congestion? What makes my throat irritated? Can my sinuses be healthier? And do I need sinus surgery? There are many other questions that might touch on the ABCs of ENT, but these are some common ones that I often hear in the office. And so I thought I'd start by looking at the nose and sinuses from an anatomy perspective so that we can work to understand how the nose and sinuses should work, and then what happens when they don't, and what can we do about that. If you've ever asked any of those questions, you are not alone. In fact, the latest numbers suggest that every year about 37 million people suffer from sinus problems, and that's about 14% of adults in the United States, so about 1 in 7. It's a little bit more common in women than men, and the symptoms aren't just in the nose. You can have problems with nose and sinuses that cause other problems: poor sleep, difficulty concentrating, irritability, depression, missing work, or missing out on the things that you want to do. And when we look at quality of life things, there are, in a given year, about 73 million total restricted activity days. So things that you would want to be doing, your activity, you can't because you don't feel well. So it's a big deal. And this is happening around the whole year, although some seasons, if it's related to allergies, may make sinus problems worse. So let's talk about some anatomy as we go from the outside in. We all have seen our own noses and other people's noses, but most of us have not seen what holds the nose up. Of course, it sticks out a little bit, and that's because we have bone and cartilage that are a framework, kind of the tent poles of the tent. And as you can see, there are support structures that are made up of bone, the upper third, and that you can feel is a hard structure, and the lower 2/3 are made up of different cartilages. One issue that I'm not going to get too much into, but when we talk about nosebleeds, people often say, yeah, I pinch my nose up here when I have a nosebleed to stop it. And if you understand the anatomy, you would understand that wouldn't make much sense because you really can't squeeze those nose bones together too tightly. And so again, if you have a nosebleed, you want to pinch the area that's soft, that's cartilage, and that can help stop a nosebleed. But as we move from the outside, a little further in, we get into the nasal cavity. And I wanted to make a couple points here. The nasal cavity is this space inside the nose that's divided into a right and a left side by the septum, by the structure made up of cartilage and bone that's like a wall between the two. On either side there are ridges of bone that hang down and are covered with soft tissue. These are called the turbinates. And the whole nose and sinuses are lined with mucosa. Think of it like wet skin, in that it is a covering, but it's different from the outside because it secretes, as the name would suggest, mucus. And so our nose should be moist and should be wet, and that's due to the mucosa, which is a very, very, very important part of the anatomy of our nose and sinuses. What does the nose do? This may be something we've all taken for granted, but I want to take a minute and say it does a lot. It helps us breathe. We are actually obligate nasal breathers, meaning that we're supposed to breathe through our nose, and when we can't, we feel fairly uncomfortable. It can dry out our mouth, can lead to other issues. When infants are born, they want to breathe through their nose, and we should continue doing that as we're older as well. It functions to filter out the dust, the dirt, the pollens, the viruses, the bacteria that are often in the air around us that we don't see, so they don't get into our lungs. So it serves as a filter, a purifier. It humidifies the air. It actually puts some of that moisture from the lining into the air that we breathe to, again, help the lungs function better. and then it warms the air, which we all know in the winter in West Michigan is an important function. And of course, it helps us smell by allowing the particles that are in the air to pass by the nerve of smell inside the nose and sense that as smell. And I want to distinguish the nose itself from the sinuses because they really are separate. In fact, the full name of sinuses is the paranasal, next to the nose, sinuses. And they're these hollow air-filled cavities that are in our faces. And they each have openings that drain into the nose. And so there are 8 sinuses, a right and a left. We have the frontal sinuses, the maxillary or cheek sinuses, the ethmoid sinuses between the eyes, and then further back even the sphenoid sinuses, which we'll look at in a CT scan form in just a moment so we can understand this better. And again, really important point, they are all lined with mucosa. If you've ever seen a CT scan, then you've seen this before. That's what this is. So in a couple of different views, taking x-rays, passing x-rays through our body, we get pictures that, as you see on this side of the screen, show with the dense bone, white structures, and then air-filled spaces in between. So the cheek sinuses on either side, that septum that we talked about before, dividing the right from left side of the nose. If you look at it on a coronal view, we call it, kind of slices of bread in this direction, you actually see again the eye contents, the brain, and then bone separating all of these different areas into nasal cavity and sinuses. And if we were to go, sometimes looking at a 2D image is a little tricky, so if we go to just to kind of give you the understanding of the 3D anatomy, if we were to look from the tip of the nasal bones and scroll back, you'll start to see again the air-filled of the sinus. The frontal sinus is up here, and this is the skull. The nose here, again divided into the right and left by the septum. Moving further back on either side, underneath the eyes, we see those cheek sinuses. Between the eyes, we see those ethmoid sinuses. And all the way back underneath the brain is the sphenoid sinus on either side. And again, all of those sinuses collect around and drain into the nasal cavity. The sinuses are separate but very related to the nose. So you said the sinuses in the nose are different. They're separate. So what do the sinuses do? Well, that's actually a great question. We don't really know. We know what happens when they don't work well, but there's some theories about why we have them, and one is that it gives us voice tone. So if you have an air-filled space, than if you had solid bone. So there's resonance in our voices. It's a crumple zone of the face. So again, air-filled spaces can collapse if, heaven forbid, there was trauma to the front of the face, protecting the other structures of the head, such as the brain. And then, of course, air is lighter than solid bone. So some people say we have sinuses so that we don't have to carry so much weight in our heads. So again, we don't quite know why we have them, but we do know how they work, in the sense that there is mucus produced by that lining, again, that mucosa, and that's resting on the surface, and that mucosa actually has kind of a hair, cilia they call it, that actually wave and move that layer of mucus through the sinus, from where it's produced on the edges, all the way up and into the nasal cavities, through the single opening that each sinus has, into the back of the throat, which then we swallow. Again, an important point is that typically the mucus flows in one direction out a single door. And problems can happen if multiple openings are present in the sinuses. Let's just imagine instead of having one entrance, we had both of these doors open, and people could circulate into this room from one to the other. And what could happen, and this happens for some patients, is that you get a recirculation phenomenon. The mucus that should go out and leave comes back in. And so it ends up accumulating into the sinuses where it shouldn't be. It should go. And we've actually understood now, and we'll talk about this later, how important it is to not make multiple openings in the sinus. Surgeons, back in the day, used to try to drain the sinuses by gravity, thinking that, well, if there's a bucket of snot, we put a hole in the bottom of it, well, it should come out. What we didn't understand is that this mucociliary flow is an active process that has a direction and should go to the natural opening, and so we shouldn't make any extra openings. And so we've actually changed in the last 20 years, changed how we've done sinus surgery because of that. And we'll talk about that in a little bit. So this sinusitis, Doc, I've got the sinusitis. I hear this sometimes, I've got the sinusitis. Well, any itis is inflammation. And so sinusitis doesn't necessarily mean an infection, but it certainly means inflammation. And it's a fairly simple process that occurs in that there's a trigger, and this may be allergies, this may be a virus, this may be bacteria, that causes swelling of, you guessed it, the mucosa, the lining of the sinuses and the nose, by definition, because whatever we breathe and whatever we're exposed to comes through the nose first. That leads to, again, if you have one opening, some narrowing. And that drainage pathway gets blocked, and the natural mucus production continues, but it doesn't come out of the sinus. And then what happens, like a pond that sits stagnant and things grow, you end up having an infection, which causes more swelling, which causes more blockage, which becomes a vicious cycle. So sinusitis happens because of a trigger. What does it look like on a CT scan? Well, you saw the normal CT scan a little while ago. We want to see air. We want to see black spaces within the sinus. And when we don't, we can say, aha, there's inflammation present. And even in this scan, where the normal left, this is the patient's left side, the CT shows nice black air and bone, which is thin. You can even see the lining has swollen up to the point that we can see it on the CT scan, which is abnormal. And when the patient's laying down, there's a little meniscus, a little bit of fluid that's resting in the back part. That's an infection. And that being said, that can also show up as inflammation kind of scattered throughout. Again, the gray areas, instead of being nice and open, are becoming blocked up. So how do I know if I have sinusitis without getting a CT scan? Well, three main symptoms. One is that there's a discolored drainage from your nose that may come out the front or out the back. That may be associated with facial pain and pressure, and with a blocked, congested, stuffy nose. In addition, not required for the diagnosis, but in addition, some patients have headaches, decreased smell, fevers, dental pain, because of where particularly the upper teeth go into the cheek sinuses. They can have indirect pain there. And this is for an acute sinusitis. The definition for acute or chronic, acute meaning very short term, is less than 4 weeks. And that's a very important distinction, which we'll talk about. Most acute episodes are viral and last less than a couple of weeks. If something associated with these symptoms lasts more than a couple of weeks, we classify it as a bacterial infection based on the time course. Bacteria live in the nose, so if you just stuck a swab in your nose, you're going to find some bacteria. So again, that time course is very helpful for us if a patient has these symptoms. Well, what does a viral sinusitis look like on over a week period? It's very important to look at the symptoms, which tend to peak in the first few days of nasal discharge, obstruction, headache. Interesting to see that cough, which about 40% of patients have, which we think probably is related to drainage from the nose, is the most persistent symptom and may actually last for weeks after a sinus infection. But it's important to see that the trend is, after the peak, these symptoms all start to get better before 14 days. So for viral sinus inflammation, it's getting better. Even if it's not all the way better, it's getting better within a couple of weeks. Recurrent sinusitis are episodic attacks which get better between them, so there's full resolution. and each attack lasts less than 4 weeks, and it's occurring more than 3 times in the year. Chronic sinusitis, again, I talked about that definition being so important, that timeline of 4 weeks acute. Chronic is lasting for more than 12 weeks. That's a long time. It's 3 months. And so, that being said, chronic sinusitis may not be associated with an acute infection. And you may not have, in the definition of chronic sinusitis, an active bacterial infection, although bacteria may have been a trigger for this. It may be caused by allergies, asthma, polyps, your anatomy not letting something drain out, immune problems such as diabetes, autoimmune conditions, low thyroid state, dental problems. If there's a tooth root that's up into the sinus that's getting infected, well, you may have chronic issues with the sinus, not because of the sinus itself, but because of the teeth. So it's important to kind of think about all those things as we talk about it. I mentioned allergies as a potential cause for that sinusitis trigger and chronic sinus inflammation. And so we've all heard of allergies as well, and I hear that a lot too. I said, oh, I've got the allergies, doc. And that being said, it's very well understood why our body treats certain things as an allergen, but we do know that an allergen, a cause of allergies, is any substance that causes an allergic reaction. And so, in general, and this is something separate from infections, viruses, bacteria, fungi, they can cause infections because they grow and invade tissue and cause problems in those cells. Allergies cause problems because we respond to them by creating antibodies to that substance, which then, if we're re-exposed to that substance, identify that substance to our body as something that it should destroy, which subsequently causes a release of chemicals, such as histamine, which we know causes itchy eyes, watery eyes, runny nose, congestion, itchy throat, those sort of things. So it's actually our response to the allergen that's the problem, not so much the allergen. But it's an important concept to understand as we go forward. Common conditions outside of nose issues, which includes allergic rhinitis, are asthma. So that's an overactive response to things you breathe into. Eczema, which is our skin responding abnormally to things in the environment. And in these situations, a family history is often present, although not always there. And so there is probably some genetic component to allergies, as well as what we're raised in our environment, although we don't have a gene to test and prove, when a baby's born, what allergies they're going to have. Yeah. So how do the allergies affect the nose and sinus? I mentioned that trigger. So when you breathe in these particles, they go into the nose because, again, it's protecting your body from getting that stuff in the lungs. So it traps those things in your nose, and these are, for example, pollen, dust mite debris, animal dander, and that causes that allergic response. Our body then releases chemicals which causes symptoms such as watery eyes, runny nose, itchy throat. And so we talked about allergies being a cause for some trigger, and chronic sinusitis and viral sinusitis. So I think it's pretty straightforward to say antibiotics are not always necessary for sinusitis, and in fact, most of the time are unnecessary. Again, most of the time taking into consideration that a lot of the sinus problems that we end up facing from the acute issue are related to viruses, and chronic sinusitis may be related to something other than an acute bacterial infection that's just been there for months. So again, viral infections, they're not going to respond to antibiotics. And so we want to be very careful in this day and age to be thoughtful about using antibiotics for infections if they're not necessary, if we're going to get better on our own without antibiotics, or if they're not going to help and could cause bacterial resistance, drug resistance, or just reactions to the antibiotics, diarrhea or rash. Well then, if antibiotics aren't the answer, how do you treat sinusitis? And so again, we talked about viral sinusitis being able to run its course, but we may want to treat the symptoms with pain relievers over the counter, nasal steroid sprays, and saltwater irrigations. We'll come back to that. This is a very important part of treatment for sinusitis. And so some patients with bacterial sinusitis may get better faster with an antibiotic as well. However, there's good evidence to say that even with that time course for an acute infection lasting longer than a couple of weeks, if you can do saltwater irrigations, nasal steroid sprays, and be comfortable with some over-the-counter pain medication, many times, in fact 3 out of 4 patients with acute sinusitis will improve without antibiotics. So even in that bacterial sinusitis category. So we just want to be very careful about antibiotics. So what things can I do at home that can help sinus? Well, hydration. Water is so important. I mentioned about the mucosa being moist. We want to stay very hydrated. In the summers in West Michigan, it gets hot. We sweat. We're in air conditioning. In the winters, it's cold. We air condition our homes as well. So it's really important to drink ounces of water a day. More so if we drink anything extra, a cup of coffee or pop or anything like that. And to breathe warm humidified air. That might be sleeping with a humidifier in the bedroom. And then again, irrigation of the sinuses and using a squeeze bottle, which I'll show some examples of in a little bit, has been shown to get into the different parts of the nose and sinus much more effectively than when people say, oh, I do something in my shower, or I tip my head with the little neti pot. A squeeze bottle is much more effective to get in and get some of the mucus and stuff out. And a very limited, if you're uncomfortable with congestion, very limited use of over-the-counter decongestant sprays, less than a few days or so. And if you're having problems despite that, that would be a good reason to see a doctor to talk about more. And so I often hear, what's the best salt solution? There are home recipes, and this one's listed here for your benefit. Making sure that if you mix the water, the water is clean, so boiling it to rolling boil for about 5 minutes or so, or using distilled water, adding baking soda and non-iodinized salt, and combining those ingredients. Obviously, if you boil water, please wait till it's cool before putting it in your nose. Also, over-the-counter nasal saline irrigation kits that are available, shown here, Neomed, Air, and they come with these pre-mixed salt packets and a reusable squeeze bottle. And what you'll hear me say in my clinic often, asking patients who ask me, well, how often could I rinse my nose out? My response often is, if you have nose problems, it's kind of like asking the dentist, how often should I brush my teeth? You'll probably never get them to say, you're good, you've done it for 20 years and you're good. Because unless we can relieve the problem, for instance, with allergies, and make your sinuses not have any inflammation, you may periodically or even on a routine basis need to use this. And so if you do, make sure you change your bottle periodically and clean it. Well, I don't want to get into the situation where I'm treating sinus problems. How can I prevent them? Number one thing to say is not to smoke or be exposed to secondhand smoke. Irritation from the lining of the nose from smoking can be a big issue, causing the lining to dry out, the lining not to work well, leading to problems. Avoiding allergens, if you know what they are. And we'll talk about that a little bit. And then dry, dusty environments, using a humidifier as needed, staying hydrated. Water is so important. I love to see the water bottles around. Drinking water is a great thing to do just in general for your health, but also for your sinuses. And then seeking treatment for chronic allergies before you get into the situation where you have either active infections or chronic sinus inflammation that isn't going away with the therapies we talked about. So when should I see my doctor for sinusitis? Well, certainly if you have acute sinusitis symptoms and you're rinsing your nose out with the saltwater irrigations a couple of times a day, the over-the-counter steroid sprays are available now and you've been using those. You're not starting to feel better in that first couple of weeks. If you develop in a year multiple episodes of sinusitis, and the idea there is maybe you're getting better in between, but maybe you need something more done, I should say, more involved to prevent them from occurring. You develop chronic sinusitis, so chronic issues lasting more than 3 months. If you have chronic allergies, then aren't just, okay, here's a spring, I take a little Claritin over the counter, and I'm good to go. Well, if they're chronic allergies, you may need to be checked out to, again, assess them further and prevent them from becoming more of a problem. And of course, anything that's very concerning, such as very high fevers, sudden change in your vision, one of your or both of your eyes become swollen, neck stiffness or uncontrolled pain. And so what medical therapies would my doctor consider initially? Making sure you're comfortable, making sure you're on the topical steroid sprays and antihistamines if you have some of those histamine-related symptoms. Oral steroids, for comfort and to speed the healing process, to help decrease some of the inflammation, to get you out of that vicious cycle of sinusitis. Oral antibiotics, depending on, again, the criteria that we talked about. And then immunotherapy for allergies. So what is immunotherapy? We talked about allergens as being the substances that our bodies react to. And immunotherapy is giving you those substances back in time, over and over and over and over again at a specific level until tolerance develops, until your body says, okay, cat dander, I'm not going to get so excited about that. And so it teaches your body to ignore the allergen, because again, the allergen is different than a bacteria, which is going to start growing and causing an infection. It is the response from our body that causes the problem. And over time, if you have immunotherapy, exposure in the real world to untitrated doses, just natural occurring amounts of the substance, will then tend to cause fewer symptoms. However, this process takes months and even years. And so it's very important to, if you initiate immunotherapy, to continue it. There are two forms of immunotherapy. One is injection in the skin, and that's administered in the doctor's office. Typically, it's on an every other week or weekly basis. And so you would be in the doctor's office and you would be observed for about 30 minutes or so to make sure you didn't have a serious reaction to that, and then you'd come back and do it the next week. And that's not so fun, and in fact, it's an artificial way of giving you the allergen, because most of us aren't injecting the substance under our skin. Most of us are breathing it in or getting exposed to it through the lining of our mouth or throat. And so recently we have now available sublingual, underneath the tongue, drops that can administer that allergen. And the beauty of that too is that you can take those drops to Costa Rica, to Paris, to wherever you may want to be, to Detroit. And of course it's not a shot, so that's a nice thing that we now have available. When should I get a CT scan? Because I think you've talked about some, I think I might have some of these things, but we're not sure. Well, certainly if you're concerned that you're having more than 3 episodes of bacterial, again talking about more than 2 weeks sinusitis in each year, more than 12 weeks of sinusitis, inflammation, and you're getting treated for that, and it's not getting any better. And if there's a complication from sinusitis that's suspected, such as an eye or brain infection, and additionally, if the diagnosis is not clear, because many patients have nasal congestion and headaches and maybe some discharge from the nose, and they've been treated for sinusitis, but they're not getting better. And a CT scan may help us determine the patient may have something as simple as a migraine that's been chronic and ongoing with some nasal congestion, and they don't have any actual problems with the sinuses. So if the CT scan doesn't show any issues with the sinuses, that can help us know we can focus our attention on other things. What is sinus surgery? Because, what if medicine doesn't work, and what might be the next step? And we call it functional endoscopic sinus surgery, and that's a great descriptive term, because as I mentioned before, if we just made a hole in the bucket and expect that bucket to drain in the sinuses, it won't, because by gravity, I should say, because of that mucociliary flow. So we want to go in and naturally open up the sinuses so they can drain through the pathway they were designed to drain through. And that's done, with an instrument called an endoscope, which is like a telescope that goes into the nose. So incisions are not placed on the face. The procedure is done through the nose, through the nostril. And then instruments are used to remove pieces of bone and inflame mucosa or polyps if those are present. Additionally, balloons can be used, can be placed into the various sinuses to open up that natural opening and make it wider. And sinus surgery may be combined with surgery to help correct the obstructive nasal anatomy, such as a deviated nasal septum or enlarged turbinates, narrow nasal cavities or collapsed nostrils or crooked nose. All those things can play into how our nose works, how the sinuses work as well. And then, of course, the question is, do I need sinus surgery? And so I have got this scan that showed some sinus disease, and you may be a candidate if you have 4 or more episodes of recurrent sinusitis every year, or chronic sinusitis despite medical therapy, with narrow nasal cavities that predispose you to that sinus inflammation. Again, when we talk about that pathway of sinusitis, blockage, obstruction really sets us up for further problems. And so opening that up with sinus surgery can help us breathe better, really live better, feel better, do the things that we want to do, and live fuller lives. And so again, I want to turn this, that's the talk. Hopefully that generated some thoughts and questions for you. I would love to take any questions that you might have.